Hello, everyone, and welcome to another podcast from the Healthy Dog Workshop and Healthy Dog Expo. My guest today is Olivier Morin, founder of One TDC Works So Well. Olivier, I've known Olivier now, I don't know how many years. And the one thing that stands out about him to me is his passion for sharing information and educating dog owners. So that's what you're going to get today. Welcome, Olivier.
Thank you. I'm excited to be here.
Yeah. So you're here. I know you have a friend with you.
I got little Sasha here.
Yeah.
And I literally used the product to tease her to always come around the frame.
So if you ever doubted that dogs don't like the product, they like
She
the
loves
product.
it. Yeah.
My dogs are challenging sometimes because they're licking so much at it.
Yes, exactly right.
On the gums. So the product we're talking about is, of course, One TDC, which stands for One Tetra Deco. Okay. And tell us in a nutshell what One TDC is.
So One TDC, forgive me, I'm in New York City. So if you hear the sirens, that's common sound over here. I don't see you, Lori. I don't know if the audience can see you as well.
Oh, no, not again.
I see a beautiful picture of the background, which is very nice, but I don't see a beautiful face.
All right. This happened a couple weeks ago, as many of my viewers know, and we were unsuccessful in resolving it.
Okay, but Janet is saying that you can see us both. So I can't see you, but the audience can see you.
This is exactly what happened.
Okay, got it.
So we're going to roll with it if it's okay with you.
Totally fine. So let me tell you about One TDC. Well,
please.
One TDC, if you kind of had to boil it down, it's the one supplement you want to use because of its properties. And the source of it is a very, very unique fatty acid from beef tallow. And it's kind of funny because my wife is a nutritionist and she's been for the past few months now bringing back beef tallow for us to eat. And a lot of times people will say, well, that's just like beef tallow I cook with, which is healthy. I say, well, yes, but it's a little bit different. There's different properties to our beef tallow. We actually take multiple oils together of beef tallow and we put it at a very specific ratio. And then we heat it up. And when we heat it up, we create this incredible molecule that has such powerful efficacy. And in a nutshell, it promotes healthy inflammatory responses from head to tail. So it's officially America and probably the world's #1 supplement for dogs and cats for oral health and hip and joint or mobility. So effective for that. So the dog that you just saw that took off now, running off the sofa here next to my couch, is 14 years old.
Wow.
And I'll tell you, I mean, this is all I give her for hip and joint and obviously oral health as well. And that's, I mean, let me talk about the product. I'm pretty passionate as you had mentioned. Oral health to me, it's an absolute passion. And I'll tell you why. Because of the lack of education. A lot of your audiences are obviously more educated when it comes to health for their dogs or cats. But the reality is the average Joe out there has no clue that an unhealthy mouth is not good for the pet. And I always test them. When I go to parks and talk to people, strangers, and I can see them, I say, you love your dog? And they say, more than anything else. And I say, well, I got one question for you. You say, yes, what is it? They say, do you brush your dog's teeth? And few of them will say yes.
Mm-hmm.
Most of them will say no. And I say, well, you don't love that dog that much. And they look at me, what do you mean? I say, well, you need to understand. Imagine if you didn't brush your teeth for 6 months, how do you think you would feel? So some people say, well, I feed this, I feed that, I feed raw. I say, that's great. How about you feed raw yourself and then you don't brush your teeth for 6 months and see how you feel? And it's not to make fun. It's also simply to educate because, and you know this from the veterinary world, there are thousands and thousands of patients coming into a clinic every day with a mouth that is painful, and they leave that clinic with a painful mouth. Why? Because so few people do enough work to protect that mouth, preventatively or when there's an issue. So, what does 1TDC do? Well, it's going to promote super, super healthy gums. And systemically, it's going to work in the muscles, the tendons, the ligaments. The entire orthopedic aspect of the pet is protected and helped. So that's our passion, is how can we help you be more effective in recognizing that there's a major discomfort in the mouth.
Mm-hmm.
If there isn't, to celebrate that and continue what you're doing. But
Yeah,
no matter what you're going to be doing, you can benefit from using 1TDC to keep that mouth healthy, which is so important to us.
definitely. And, seeing, I was talking with a cat owner today, and cats, of course, are cats. They can be rather impossible to brush teeth and do things
True.
with, but you can get them to accept 1TDC. And that's a testament to how pleasant tasting and everything, it's easy for the cat to accept. But you want a awful mouth. Look inside a 12-year-old cat that's eaten kibble all its life. And, we'll flick off bits of tartar that are the size of the tooth. It's like that's just so unnecessary if you can do a little bit more proactively.
That's exactly right. And I think what sometimes people forget, and I know you've had Dr. James Anthony, our chief
Right?
medical officer, who's a veterinary dentist. What people don't realize is it's not how good the teeth look,
Hmm.
because you could have pearly white teeth, but you still have gum health issues, which
Right.
are painful.
Right.
So having clean looking teeth feels good to the pet owner. But for the animal, what you really want to make sure for that dog is to make sure that there's nothing happening underneath the gums, that there's
Yeah.
no bleeding, or the breath is usually a telltale for that. It's not always just oral health, it can also be the gut. But a
Mhm.
lot of times it is what's happening in the mouth.
Yeah. I want to highlight Jane's comment because this is something that raw feeders say, and I've certainly said the same thing. But raw meaty bones do not do the same thing as 1TDC. Can you elaborate on that, Olivier?
Yeah, that's really important because raw meaty bone has some value, perhaps,
Oh,
in
I love raw meaty bones. Don't
right.
get me wrong.
But when it comes to actually protecting the most important part in the mouth, that's what we call, it's all of the gingival aspect, all of the gums. And a lot of the products out there will remove a little bit of tartar and plaque, which is great. But protecting what is the actual gums, which creates discomfort, is what this product is going to do. So it's very different. Whatever other things that you're doing, brushing the teeth, which you should, that's the gold standard. But let's be realistic. Less than 2% of people actually do that. Or some people use kibbles like the TD diet just for the aspect of a little treat to remove some of the mechanical removal. Great. But when it comes to the part that really matters for the health of your dog, it's the gums. I would say it's 80% of the problem in the mouth is the
Yeah.
gum aspect of it. Of course, there's caries and different things that can happen and
Mhm.
teeth issues that have to be managed, but usually that's a result of not managing the gum issues. So it's like, very simply, you have bacteria that get trapped in the tartar and the plaque. They go underneath the gums. They're anaerobic, so they don't need oxygen. And then the body says, whoa, what's going on here? We've got a foreign object. Let's go attack it. So the immune response, attacks it. So all the prostaglandin, all the cytokines, all of that activity is going on. And as a result, it's destroying the anaerobic bacteria. But it's destroying everything around it.
Right.
So one TTC comes along and says, okay, I'm going to help you promote healthy inflammatory responses, because the aspect of the inflammatory cascade is very important for the body to be healthy. But one TDC really supports that process in a very, very healthy way. So as a result of that, you're going to have much better looking gums, much pinker looking gums,
Hmm.
not as puffed up as what you can see. And you'll see that in the behavior too of the dogs, because they feel better.
Yeah.
And I mean, I know you know this, but so often you'll have people that finally do a proper dental cleaning. And I don't mean a non anesthetic, I mean a real proper dental
Sure.
cleaning.
Yeah.
And as a result of that, what do they see? What do they find? Well, the dog's behavior has changed. Why?
Hmm.
Because they're not in pain.
Yeah.
And that always makes me laugh when I talk to people. And I don't know if I've ever shown you this, but we created this dental report card.
Hmm.
And we teach actually veterinarians to really have that discussion with the pet owners, and ask them and tell them that oral health matters, because there's a lot of discomfort in the mouth. And sometimes they can do an inspection, and they literally will look at the pet owner and ask them, is your dog still eating? And the pet owner's like, yeah. I say, well, I can tell you, your dog might be eating, but your dog is in a lot of discomfort. You have to do something about that. You should
Yeah.
do proper dental cleaning, but at the very least, you have to use one TDC to protect a much healthier gums for less discomfort in that mouth.
Without a doubt. And in all things, I think when people don't realize their dog's in pain and then they do take action and they figure out in hindsight how much pain the dog was in, they feel awful. I don't
Yes.
want people to feel awful. I'd rather you be angry at me for saying you need to do this, and yes, it's going to cost money, than feel awful about something you didn't do for your dog.
And it is, look, let's face the fact. And there's always some principles that I tell people about this for
Mhm.
dental cleaning. You should do a proper dental cleaning if you're at that stage.
Yeah.
And if you are going to do it, there's a few criteria that you should never be shy about asking your veterinarian. Number one, and that's an absolute must.
Yeah.
You ask them, do they have a dental x-ray machine?
Right.
Now you're gonna say, well, that sounds kind of silly. No, it's not. If you go to your own dentist and they don't have a dental x-ray machine, you're not gonna have the dentist work on you. So it's the same thing. And keep in mind, and I know you know this, and most of your audience knows this too. The roots of a dog's canine or the teeth is much bigger than ours. So
In
it's
some
it's
cases, bigger than the amount of canine tooth that you see.
exactly. So if you're not taking that x-ray, you don't really have a clue of what you're dealing with. It's not just what you see. So you have to have a dental x-ray machine. So that's step number one. Don't do a dental cleaning anywhere unless they have a dental x-ray machine. Second part, ask them, where did you get your advanced training in dentistry? Now,
Mhm.
that sounds kind of awkward to ask the doctor that question, but you have to understand, if you go to a generalist, they can't know everything. It's not
Right.
insulting them. It's being realistic to the fact that, some have more passion about dentistry than others. So you ask them, did you do any advanced training? And there's incredible dentists out there, including Dr. James Anthony, that do a lot of advanced teaching.
Yeah.
In Maryland is the ADTC by Dr. Ira Luskin. Fantastic location. I mean,
Mhm.
we go there, we teach about one TDC all the time, and they learn how to do extractions. They learn how to do perio flaps, all those more advanced that are necessary, so that you don't necessarily have to go to a more costly practitioner, which will be your dentist.
Yeah.
And sometimes you do need them. But you really have to ask those two questions: dental x-ray machine, and what type of
Yeah.
advanced training have you had in
Yeah.
dentistry?
Back when I was in vet school, we had, like one lecture on dentals. It was back in the dark ages. And it has gotten a lot better,
It has.
but there is so much more that can be done, even with a weekend in master class, they learn so much more.
They do. And they build their confidence
Yes.
in doing the work, and also learning how to use the equipment, because it's not because you have a dental x-ray machine that you actually know how to optimize it.
Right.
So, and of course, you got to have blood work. That's like a
I
must.
mean, good anesthetic practices.
Absolutely.
Blood work, x-rays if indicated, full monitoring, fluids, the whole 9 yards. This is
Exactly.
not a place to cut a corner.
It is, and so when you need it, you need it. So what we did is we actually created the dental report card here
Mhm,
that you can see. We actually give that to the veterinarians as well. But when people get the one TDC product from us on the worksowell.com website, we will generally send you a copy of this.
mhm.
And this is a really cool, simple tool. It was designed by veterinary dentists and veterinary specialist technicians to help you at home do a self-evaluation. So is it as complete as going to your veterinarian? Absolutely not. But it gives you an indication
Right, right.
because our perspective is this. If you don't need a dental cleaning, you shouldn't get one. If you do, obviously you should. So
Mhm.
how are you going to find that out unless you go to your veterinarian? Well, this is kind of like an in-between step.
Right.
We provide those. We actually literally give those to our clients. And the way that you do it, there's a little gauze in the back here, and you take that gauze and very gently you swipe it on the gums. Now, unfortunately, probably about 90% plus of the time when you do that, you see blood on the cotton.
Mhm.
And that's not normal.
Right.
Blood is not normal. It's not normal for us.
Mhm.
So why should it be normal for your dog? So you take that, and then inside of it, you have like a little measurement. I don't know if you guys can see all that well on it, but you have little measurements and pictures, and it tells you the thresholds of pretty much where you are so that you can make the self determination to the best of your ability if you have pain or not. And
Mhm.
if you do, go to the veterinarian, have it checked out.
Yeah.
Start the one TDC2 because it's going to definitely make it more comfortable, and then determine if you do need a proper dental cleaning. Now, here's the good news.
Yeah.
If you do need a dental cleaning and you get it done by the right practice and you start using one TDC before, so there's less discomfort. Simply put, think of it this way. If you've ever had gingivitis and you do a deep dental cleaning, the next day you're in a lot of hurt. There's no difference with your dog. So don't wait to use one TDC after the dental cleaning if you can't use it before. But
Yeah.
here's the good news. If you actually use one TDC on a continual basis after a proper prophy or proper dental cleaning, you're going to get less tartar and plaque build back up, and the gums are definitely going to be preserved in a much pristine way than what they were before. So what we're finding, and that depends on the pet, and of course you should check that with your veterinarian, is if you use one TDC in between the dental cleanings, you probably need less of them. If you brush, like I do with Sasha, who's 14 years old, she doesn't need any dental cleaning because it's looking really, really good.
Yeah.
So it saves you money in the long run.
Definitely saves you money. Anything you can do proactively is generally going to save you money. Now, we say, and I know and I know the products well. Exactly for the person who's never encountered it before, how do they use it?
Good question. So if you give me a second, I'll actually will demo that.
Oh, that'd be terrific.
If Sasha is willing to come back up here, she usually does when she hears this,
Yeah.
although she's getting a little deaf in her old age at 14. All right,
Mhm.
so this is the product, and I'll show you what it actually looks like. This is a little heart-shaped soft gel, and there's two hearts. There's a heart at the top, the bigger one, and the small one. So what you're going to do is you're going to hold the little heart, well, if I can get little heart here, and then you twist it. You
Okay.
twist it open. So remember, this is, as you saw, very palatable. So Sasha, if you want to come in frame here for us,
Frame.
maybe I'll move it for
Wait,
her.
wait, maybe I can make the frame bigger.
There you go. So she wants to eat it right away, and then I'm going to lift her lips and I squeeze the product on the gums. That's all I do.
Okay.
Now you're going to say, well, should I rub it on the gums? And by the way, she wants to eat this. That's why I'm keeping her in frame here because
Yeah.
she's so gentle biting into it. And
Not like
then
my dogs.
yeah, right. So most dogs you can't do that. And then I just give it to her. So in her case, she's 40 pounds, so I'm going to give her two. And so what I was saying is, I am not going to rub it on the gums, and here's why. In her case, it doesn't matter because she has super healthy gums.
Mhm.
But if your dog had gingivitis or discomfort in the mouth, and I just put it on the other side for her, it would be painful to rub it. So I don't want you to do that. Just squeeze it on the upper gums. That's it. It's going to cover the bottom as well. and you can see her gums are looking very, very healthy for a 14-year-old dog. She doesn't like me doing that. Sorry about that, honey.
Yeah.
Um, and it very little of the product, and this is the part that's really cool about this product, very little of it has to come in contact with the gums. Because this molecule, and this is what's so different than usual fatty acid, this molecule is very absorbent. So the moment I put it in the mouth, the moment it comes in contact with the gums, there's a portion that right away goes into the gums. And because it's so concentrated and it's attracted to white blood cells, the T helper cells, it's focusing in the areas that are doing all this inflammatory cascade, and we're promoting healthy inflammatory responses at a cellular level. And as a result, very little goes through the gums, not needed much because it's so concentrated. And then systemically, it goes through the rest of the body. And now what does it do? Well, it's seeking areas that need it most, where the white blood cells are working.
Mm-hmm.
And I'll tell you, this is the part that's really amazing. And a lot of people don't know this. A lot of people use fish oil, which I love fish oil. I think there's a lot of benefits for it, especially for brain cells in the skin.
Mm-hmm.
But here's the deal. If you put fish oil in the mouth of your dog, it's not going to help the gingivitis. Maybe a tiny bit, but it's not going to go through. Why? Because fish oil or granulate muscles, all those products, they're not transdermal or transmucosal. So that's number one as a difference. But I mentioned that it also has an affinity for T helper cells, the white blood cells. So as a result, here's the deal. A dog like Sasha, she would need about 4,500, about 50 pounds, 4,500 milligrams of fish oil to be therapeutic for the orthopedic side.
Mm-hmm.
But with one TDC, because it has this attraction to where the T helper cells binding with it, I don't need nearly as much. So in comparison, as a loading dose, all I need, 4,500 milligram, I only need 840. So it's a fantastic product where you don't need a lot of it to be therapeutic. And truth be told, most people don't actually give therapeutic dose to fatty acids because it's too high. It's too much for the liver to process. So that gives you kind of the synopsis on how to use and why this is different.
Yeah. Yeah. And as you can see, it's really not that hard to administer at all.
All you gotta do is this.
Yeah. Yeah.
Matter of fact, we had to change our voicemail on our company because we actually are live people that you can actually talk to.
Sure.
Because many times the dog would get a hold of the whole bottle and eat it. So people frantically would call us, oh my goodness, my dog ate the whole bottle. Do I need to go to the veterinarian? Is it serious? And it's perfectly safe. It's an expensive lunch, but it was fun with the dog.
Janet has an important question.
Yes.
And this refers back to the last time you and I talked. Should you adjust your fish oil dose when you start using 1 TDC?
Good question. So the way that actually our chief medical officer that you've had on answers this is this. As a general rule, and you have to keep in mind, he's used the product with over 20,000 some patients.
Sure.
But as a general rule, what he says is reduce your fish oil, other fatty acids by half.
Okay.
And it's also to be cautious just in case they're actually giving a proper loading dose of that fish oil, which, like we talked about, is quite high. In my opinion, it's too high. It's not sustainable. So as a general rule, reduce whatever you're using by half. I still think there's benefits from fish oil. I mean, in the case of Sasha, I'll give like coconut oil, different things like that, quality ones that I can take. And by the way, 1 TDC is 100% human grade.
Yes.
And maybe I can even demo you that I actually will eat the product myself. I have to do a video about this. This is a funny story. I literally pod those in, and this is being recorded, so be careful what I say, but it is human grade. I will literally pod those into my mouth every night. And then I have Sasha come up. I do brush her teeth. And then I give her the 1 TDC as a reward. So this is something that's a little bonding thing that we do every night. It's our routine.
That's funny. Yeah, you have to do a video with that.
We do. So yeah, the second question about the human product. That's a good question, Janet. So the human product, do you need to reduce your fish oil by half? Again, same principle, I would say. If you're using a very high therapeutic dose of fish oil, then yeah, you probably want to reduce it by half as well. So she has a follow-up question I can see on the side that asked, can I replace 1 TDC instead of fish oil? This is a great question, and this goes the same for your dog. Why are you using it? If
Yeah.
you're using it for orthopedic benefits, I can tell you that I just use one TDC for Sasha.
Yeah.
On my side, well, I'll take some other stuff like vitamin E and stuff like that, or vitamin D because I live on the East Coast. Um, but do I take an extra fish oil per se? No. And I also have a healthy diet. My wife is a nutritionist, so I think I get plenty of the healthy fatty acids that I don't feel the need to have any additional ones. And that's that's it's you between you and your doctor. You have to figure what makes sense for you. But
Yeah.
if you're using it for orthopedic purposes on the human side, this stuff is really really good, and the properties are completely different. So if you combine, there's no issues. Just reduce it by half.
Yeah. And since you've kind of gone there, most people are floored to hear that a product that is intended for dental health and periodontal health can also be used by physical therapists or in physical therapy programs
Absolutely.
and can be used transdermally, of all things.
Absolutely. And that's a big one actually. If you think of,
Yes.
think about, those glucosamine products and so forth, you're not going to rub that shoe on the knee of your dog. It's
Mhm.
laughable, right? It won't do anything.
Well, and the number of dogs that are blowing cruciates and are post-op and everything, and the amount of inflammation in that joint, this is where the future is going, I think.
I think it is, and I think this is why we always tell people just understand this product is not just dogs love it and they eat it, but really optimize it in
Mhm.
the mouth, systemically, and topically. I mean, part of that routine with Sasha, when I give my three and I brush her teeth, well, actually, before I brush her teeth, I actually every night put a soft gel on her left knee because she was very athletic as a frisbee dog,
Mhm.
and CCL torn both sides, but one area is a bit more calcified than the other, and I know that she's going to build discomfort in there. It's inevitable. So I proactively put one soft gel topically on her knee on the inside, and some of your guests that you have as well and mutual friends, Dr. Taraka with Wizard of Oz.
Mhm.
She uses it after every laser therapy. And the logistic behind that is we're going to prolong the benefit of the laser. So the topical aspect after photomodulation is very, very important. And I really want to stress that for you folks that have senior dogs, please put one TDC to the test and use it in all the different facets that we're talking about: the mouth, the oral health, the joint health, and the topical aspect. That's what I personally do with my dog.
Yeah, that is awesome, and Debbie has talked long and frequently about 1 TDC and lasering through it and just, as you say, optimizing what the product can do.
Exactly. And I see you have a couple of questions I can answer for that. Tracy asked, is there any soy, gluten, or seafood? So let me answer all that. Gluten,
Yeah.
no. Seafood, actually, ironically, there's a little bit of salmon oil, wild caught Alaska salmon oil, and we measure for the iodine and all of the mercury
Right.
and all of that, make sure that we have all the reports on that. This is the one that I wouldn't say laugh, but always is controversial, is soybean oil.
Mhm.
Soybean oil has such a negative press, and for good reasons, because there's a lot of junk in soybean oil. The truth is, soybean oil, quality soybean oil, meaning non GMO certified soybean oil, actually is good for heart health. And a lot of people have heard so many negative things that they venture there. And let me tell you, there's some soybean oil in 1 TDC, but it is non GMO. I wouldn't put it in my mouth if it was. And I definitely would not give it to my dog otherwise.
Yeah.
And we eat a lot of soybean here because my wife is Japanese, so we eat natto, we eat all kinds of soybeans and so forth. But non-GMO is the key.
Well, and as you say, the entire soybean plant gets a bad rap.
That's right.
Um, and certainly I think of people who use or companies that make use soybeans in dog food. You know, how many times have we say don't buy anything with corn, wheat, or soy in it?
That's right. Because
Crazy,
it's poorly
crazy.
farmed.
Yeah,
Yeah, no, I agree. So that's a great question, and I'm glad I can address that one.
yeah. So the rehab, and of course, that's something that rehab and athletic dogs, sport dogs, competition dogs. Um, you have a bunch of those using the product.
That's
Um,
a agility jersey right there. We actually sponsored
there
the
is.
USA team, the WAO team, and we've been doing it for years. Wonderful group.
Yeah. And these dogs are, the canine equivalent of the elite human athlete. So I guess that begs the question, why does the human athlete not use one TDC? Or is that where you're going next?
Well, they do. So there's
Yeah.
a
Oh,
cream of joint and muscle for one TDC was very popular. Um, and so that's a wonderful cream. And a lot of times when we have little flash sales, we actually give some of those to folks so they can try it out. And I got to tell you, I personally use it, but I'm also on the supplement myself.
sure.
Um, but it's definitely for athletes. The key thing is it's the uniqueness of one TDC and what we offer. It's working from the inside out from a supplement standpoint systemically, but you have the ability to go from the outside in topically. So
Hmm.
for athletes, it's the exact same thing. It's you're recovering, you're trying to reduce some of the stamina, the lactic acid, all of those negative factors that happens in training. If we can speed up the recovery, that's the key. And that's what we found in the working dogs or the dog agility community. And by the way, if you know anything about dog agility, you're talking about very smart people, and you can't fool them because their dogs, to your point, they're athletes. So when you're talking about performance, if I tell you it has a possibility of improving the quality of performance of your dog, I can say all I want. They will know because they know exactly all the intricacies of their dog.
And they have the data, they know how many yards per second their dog is doing.
Exactly. That's exactly right. And in flyball community, it's a
Oh,
wonderful
yeah.
product as well. Because in flyball, you're talking about being timed.
Yeah.
Um, what's amazing, so we have some wonderful people in the flyball community as well. Aaron Robbins, and I mean, so many of them that have been using the product for many years. And what happens is what they see is like the beauty for this product. Look, if you're a puppy, 6 months old, you start the product prevention, you should. That's the right thing to do, protect that mouth. Orthopedically, 6 months old, they don't need anything. But as they get older, more into that 6, 7, 8 year old age, that's when they start to slow down. So in flyball, they know the time and they've seen how much it's slowed down, or actually the time goes up.
Mhm.
So it's not uncommon for us to hear back and say, "Hey, I've been using one TDC, and my dog is going back to sometimes they used to do like a year ago."
Yep.
Because they feel better, and we're lubricating all the joints and the cells, and 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 they recover faster.
Well, and helping, yeah, because every time those dogs go out and abuse their bodies, because kind of that's what they do,
Absolutely,
they're tearing up their muscles, and that has to be repaired.
absolutely,
And yeah, anything that makes that process more efficient is to our benefit.
absolutely.
So I imagine the horses can benefit as well.
Well, yes. So the horses, we have actually a 16-ounce pump of the cream,
Oh,
and that's been used topically with horses before they ride, before and after they ride, in areas where they know they're going to have more issues, and it doesn't test. So that's the beauty
mhm.
of the product as well. That's an important factor for athletes as well.
Yeah.
Dr. Kojer, is to make sure they don't test. So this is a very safe product. Um, and we have athletes like CrossFit and so forth. They love that because they obviously recover faster.
Hmm. But yeah, we don't want them testing positive for drugs.
No, we don't. And yeah, and so they're safe in using the
Yeah.
one TDC product.
Yeah.
But yeah, if you've never used the cream, I would highly encourage. As a matter of fact, probably part of your community here as well. Noreen Bennett, which is a good friend,
Sure.
in the and she does this incredible event every year, which we really enjoy going to. It's one of my favorite events to go to, the Thanksgiving
Hmm.
cluster. And then she actually always talks about how great it's been in the mouth of her dogs. She's got collies, but she also talks about how she uses the cream herself because she just did a post, I think, just a few days
Anybody's
ago.
been at that event, you're walking around on cement all weekend. You're walking
That's
long
right.
distances. There's it's a lot. And yeah, if your knees need it, they need it.
Absolutely.
So Janet wonders, are there any contraindications for one
Ah,
CDC?
That's a good question. There isn't. Um, One TDC is a very, very safe product. So that's the first thing to know. If your dog is on Rheumodale or different types of modality, you can combine. It's very safe.
Mm-hmm.
Of course, we always tell you we yield to what your veterinarian who has a full medical history of your dog will tell
Right.
you to do. But generally, it's very, very safe. Um, and as far as side effects is usually the next thing that people ask when you ask these contraindications. There isn't. It's a fatty acid. You don't need a lot of it to be therapeutic, so that's a beauty. Um, I would only caution if you know your dog, for example, has pancreatitis.
Mm.
Well, I may not put it through the mouth because I don't want to cause an
Right.
onset. But remember, it's transdermal. So if you have a dog that's got not a pretty mouth or a sneaky mouth, then you want the oral benefit. You put it on the pinna of the ear of your dog. You
Mm-hmm.
split a soft gel between both ears. You let it sit for 10 minutes. That's about the time that it takes for the whole one TDC molecule to go through transdermally. It'll go transdermal and then transmucosal and then systemic. And then you wipe it off. You don't want to leave any fatty acid debris in the ears. So there's always a way of giving it, and there's no contraindications with any medicine that you might be
Yeah.
using.
Even like an oral cancer.
No, it's if anything, when you're dealing with cancer, if you can promote healthy inflammatory responses,
You,
that's a
you
very good
stand a
thing to do.
chance of, yeah.
Yeah.
And I see we have our first spammer.
Oh, we do? Nice.
Oh yeah, yeah. Does anybody need a thumbnail designer or video editor?
Well,
They always find their way in, folks. Please just ignore them. They eventually go away.
there we go.
Um, so yeah, so I mean, I just love the idea that we have so many ways to use this and so many ways to administer it. And I always think, as I had this morning, I was complaining to you about my morning earlier off camera,
That's right.
the biting dog. I have this week actually, I've had 3 dogs come in that for the owners to medicate their ears or eyes or handle them about the head, in anything that might be unpleasant, they have to muzzle them.
That's right.
And okay, well now you can get this on the ear if there's a muzzle that must be in place.
Absolutely. And
And
it's easy to do. I mean,
yeah,
for even for cats for that matter, those they can be tough ones. And then I'm sure that some of your audience hopefully have not experienced it, but there's certain conditions in the mouth that are horrific when it comes to periodontal health issues. One specific one is cups in dogs, or known as stomatitis in cats. And those mouths are so painful that you can't
yeah,
get near them. And you shouldn't try because you don't get bit either, and the patient is in discomfort. So the topical aspect just saves that process, and you're actually able to do something to help.
yeah. And when I think of those cats, and many of you who in listening may not know, I mean, these cats' teeth are so bad that we do literally full mouth extractions.
That's
Take
right.
out every tooth in the cat's mouth. It takes my colleague Amy about 4 hours, and that's a lot of work, and she's meticulous. Um, but when something is that extreme, to have a non-invasive option is huge.
It is. It really makes a difference. And sadly, unfortunately, sometimes people can't afford to do the procedure because it's not
Oh, no, it's to have Amy in your cat's mouth for a few hours, that's a
right.
lot.
It
And
is.
full mouth X-rays pre and post to make sure there's not a remaining piece of root, a
Exactly.
fragment of tooth, anything that's going to just keep the problem going. It's expensive.
It is. It is. And it's an investment. So what we always say, if you have done that investment, then don't just let it sit there. People don't realize that within 24 hours after you do a dental cleaning, the biofilm, the initial formation that's going to lead to plaque, starts within 24 hours. So if
Yeah,
you spent $1,000 plus for a proper dental cleaning, which is not inexpensive,
right?
and you just wait another year to have that checked out, I'm sorry, but during that period of time, you've restarted the process within 24 hours. So with one TDC, you're preventing some of that cycle and you're protecting the investment that you just did. So it's actually
Yeah.
quite important to do.
Well, and that to me suggests an important point that goes way beyond one TDC. which is the investment we make in our pets, dog or cat,
That's
health versus the cost of any particular procedure or treatment modality. And, for example, I was talking to someone today about a cat dental, and he said he received the estimate and it was a little more than he'd planned on.
yeah,
Okay. That included full mouth rads and everything. But if you look at it as an investment and you start to weigh, it changes your thinking. You weigh what I'm going to get out of it. And it enables you to see some of the benefits that you might miss if you're just focused on the cost.
absolutely. And also, you have to ask yourself, how much do you love that pet?
Yeah, I I I try that, I fail because then people say I'm shaming them. Uh,
Well, I think,
I need to work on my delivery better.
I'll tell you one of the things I've seen with the dental report card
Mhm.
for veterinarians is, and it could be the technician that does it, when they see the blood and they see that there's a reaction like, I know it's not normal. We also have to understand, from the pet owners, you have a budget and you can only do so much,
Sure.
but you have to be able to gauge what is the priority and why it's so important. So you have to connect to things that make sense to you. Seeing the blood, it's not normal, that connects with you. The truth is, most time it's an infection in the mouth. And we know as human beings that if I go to the doctor and I hear that there's an infection, I'm not going to walk away and not do something about it.
Right.
So it's really understanding the importance of oral health. Look, oral health is the gateway, as we know, to a healthy body.
Mhm.
The WHO organization will tell you, if you look in third world countries, the biggest epidemic situations they're dealing with is oral health issues.
Mhm.
So it's not to be underestimated at all. So definitely take the oral health of your dog very, very seriously. What I always try to preach as much as possible is don't wait till there's an issue.
Yeah.
Start when they're young.
Yeah.
Start one TDC at 6 months old, once the adult teeth are in.
Mhm.
Sometimes when they're teething, there's a lot of discomfort. You can start before the 6 months old and then brush or get some of the cables that has the abrasion, but do something before this discomfort. And there's certain breeds, it's not a luxury. I mean, the Yorkies, the Chihuahuas, the Papillons.
Oh, the toy breed dogs. The Chinese crested is probably
Oh,
the worst set of teeth that I've ever seen.
yeah, no,
Um,
most definitely.
but yeah, and I'm always blown away. And if you have the opportunity to look at a variety of breeds of dogs, look at the teeth, even on a small Jack Russell Terrier. Their teeth are almost as big as a Labrador's, which blows you away when you think of, okay, that's the same size as another small terrier or another small toy breed dog who has half the size of
That's
teeth.
right.
But that goes to the purpose of terriers. Catch the varmints.
That's right. Those beautiful
Oh,
canines.
those beautiful canines. Um, oh, I see. Sorry, guys, I was distracted by our scammer. Sorry, you are a scammer. I don't need a free trial.
And that's great, though. I love the persistence.
I love the persistence and the self defense.
Right. Right. Well, the person's getting attention, so I guess that's what they wanted.
I guess so, or it's a very talented bot. Um,
Oh, that's true.
when you were speaking of puppies, now, I mean, to me, it seems very intuitive that this could be a product that really makes teething puppies feel better because you see their gums when the tooth is just breaking in, how enlarged, inflamed, swollen they are.
That's right.
Um, is have you encountered any discomfort on the puppy's part when you apply it, or are you just careful not to try to rub it in?
You got it. You do not rub it in. I mean, what I always tell people, particularly with smaller dogs, actually with toy breeds, when you give it for the first time, twist it open and let them smell it. Let them lick it off. And now it's going to be more like, make sure they don't swallow it before you can actually squeeze it on the gums. So you have a pleasant experience. If
Mhm.
you, in your mind, understand that this is most likely going to be received as a treat in their mind, and you act upon that, like, I'm about to give you a treat, then the dog will respond to that as well. But I will definitely, if you have any animal, maybe a puppy teething or a senior dog that has discomfort in the mouth,
Yeah,
please, please, please do not rub it in. Just exactly like you said, just like
yeah.
you saw me doing with Sasha, just squeeze it on the upper gums. And by the way, this is a common question. Do they need to eat the soft gel? No. What I care is what's on the inside. Now,
Yeah,
do they want to eat the soft gel? As you saw Sasha, she was like nibbling on it. Yeah, and they can. It's perfectly safe.
yeah. What is it made of?
Oh, it's form of gelatin of some formulations that my team have put together.
Ah,
It's
okay.
very safe. It's
It's the
again
same quality as what's inside.
exactly, and it's all human grade again. So you
Yeah,
can actually literally, and I do take it yourself. So it's all perfectly safe, all digestible,
good.
and it breaks down.
Tracy says maybe AI is seeking to enter the feed.
There you go.
Well, my not a scammer friend, you must ask a question about your dog.
That's right.
Cat. If you want to play in our arena, you have to be on topic.
Or better yet, do you brush your animal's teeth
Yeah, that's a good question.
or your own? I'm kidding. If it's a bot, you could say ask that
Yeah.
question.
Alicia's dogs chew the soft gels. My dogs would definitely. And I'm always surprised. I have a lot of clients who prefer fish oils in gel caps as opposed to squirt on it. And
Mhm.
I like that because there's less chance of the oil going oxidizing on
Right.
your gel cap. But dogs that will pick out the gel caps and spit them out. Like how do you do that? My dogs would just inhale it.
Yeah, I mean, some will they'll chew. It's kind of cute actually when you see. I see that with Chihuahuas a lot of times too.
Mhm.
They see it for the first time and they love the product, and then finally I give them the soft gel, and they chew it and they spit it out. They don't have the concept that this texture I'm allowed to eat. I
Mhm.
don't know what it is, but
Yeah.
a dog like mine, mixed lab shepherd, it's gone. It'll
Oh,
be
yeah, yeah.
wolfed down. Um,
Um, Janet asks, "Is it okay? Will they get benefit if it's just on top of the food?"
That's a great question. So if you're in a position for some reason you can put on the ear, or I know some of you guys have a lot of dogs. You have a whole herd of dogs at home. If
Mhm,
you put on top of the food, they will still get some benefit. It will not be as fast for oral health, but it will still help. And over time, systemically, it will tackle any areas that have the need for it. So it will help, especially for cats. We see that with cats. We usually say they'll lick it off. You gently put on the lips, you put on the ear, or you can put on top of food, a couple of kibbles.
mhm. Yeah, with cats, you do what you can.
Exactly. Well, cats are cats. They like one thing one day and they don't the other day.
Yeah, the next day they're knocking it off the table.
Yeah.
Um,
Gary had a question too. I don't know if you saw that one. Oh, you have another one
oh,
here.
did I uh, okay. Oh, interesting. I had not thought about that, Jerry.
Yeah, it's a good question. So, related dogs, allergics. Okay, good. I love you, Boston, by the way. What a cutie. I love Bostons. Um, so, allergies. Let's talk about that first. So, the source of the product, as you know, is from a beef tallow, beef fat, USA based. And if you remember, I mentioned earlier through the process, we take multiple oils from the beef tallow and then we heat it up at
Mhm,
400 degrees. So, what does that mean? Well, allergies, so allergens respond to protein. So, if you heat any form of protein, if there were to have any protein in the product, it'd be gone, it'd be completely denatured. So, even if a dog is allergic to beef, we generally don't get any issues. Now, I put that with a caveat because if your dog is very allergic to beef, be very careful. I would give just a little tiny bit, and within 24 hours, you're going to know if there's any responses from an allergic
mhm,
standpoint or not. So, generally, we don't get any issues. So, gastric issues, the product will not cause it, but if there's a weakness there, it may aggravate it. The example of that was also pancreatitis. We're not going to cause the pancreatitis, but if there's something that's weak there, just the fact that you have a fatty acid, it can aggravate it, and that's what we do topical. But from a gastric juice, remember also 1 TDC, you don't need a lot of it to be therapeutic compared to fish oil. So if you've used, for example, fish oil and you've had issues or the burping back all the soft gels that people give sometimes on the fish oil side,
mhm.
you'll have a whole lot less with 1 TDC. So it should be okay.
Yeah,
But again, if you have any, I always tell people if you have older dogs like German Shepherds, for example, they tend to have like weak GIs. Not
yeah.
all of them, but some of them do. So I would say, if you have a big one and you're to take one soft gel per 25 pounds, that's the loading dose for cats and dogs, by the way. There was a question earlier about cats. It's the
Right,
same thing.
right.
It's one soft gel per 30 day for the first 30 days. So if I have a German Shepherd that's 100 pounds, lucky one, he gets 4. So as a result of that, if I know there's a gastric potential issue, I'll just give 1 for the first day.
Yeah, go
And then,
gently.
and then the next day I'll go to 2, and then I'll lead up to 4.
Yeah.
So and by the way, after the 30 days loading dose, you can go into maintenance, which is 1 soft gel per 50 pound. So if you
Mhm.
have a cat or small toy breed, you do it every other day.
Perfect. Perfect. Alicia says she had an incontinent Australian cattle dog with IBD that
So that's
tolerated it no problem.
okay, got it. Okay, and that's a really good point what Alicia is bringing up, because a lot of times, depending on what's going on, one TDC promoting healthy inflammatory responses can
Mm,
actually may have some assistance.
yeah,
So remember, it's not just the joints, the muscles, tendon, ligaments in the mouth. It's anything in the body. There's a potential that it may actually help. It's actually very good for skin and coat as well. We
yeah,
get a lot of good feedback on that.
yeah. It's I think labeling it as a inflammation supporter or something along those lines is much more accurate than just periodontal health or just one
Yeah,
thing.
and the way we say it to be proper, we say it promotes
The
healthy
inflammation.
inflammatory responses.
Yeah.
This because remember, inflammation itself has a really good part.
Mhm.
There's good benefits to inflammation, but there's also some destructive parts. So we promote healthy. We assist in healthy inflammatory responses.
Absolutely. And Jerry says, "Thank you. Chicken was the problem, not beef."
Ah,
It's so
and
obvious.
got it. And of course, there's no chicken in one TDC.
Good, good.
Yeah, and there's no shellfish either. That's another common question that people ask.
Yeah, yeah. Shellfish, whitefish. Absolutely.
That's right.
Well, Olivia, we're coming to the top of the hour. This has been awesome. I understand you have organized a promo code for us,
That's right.
and my team is going to drop it in, but I believe it's HGE10,
That's correct.
HDE10 for 10% off orders.
Exactly. And it's for anything. So as we talked about the
So you can
human,
get the cream.
yes, exactly. And
Cream.
we did not restrict it just to the animal product, which is mostly what we're talking about. It's like, no, I want this to be for anyone who wants to use it.
Awesome. And you even mentioned a giveaway.
That's right. So we're gonna give. You'll let me know the logistic on that, but we're
Yeah.
giving a few bottles. I know you organized that with Melissa, so I don't want
Yeah.
to.
Yeah. I think we organized 2 bottles today. So
Perfect.
my team will randomly generate a number and then count down the comments, and the person who made that number's comment will get one.
Awesome.
So we'll have 2 of those guys. Thank you, Janet, for popping that in. And if you can also pop in the Olivier's website so people know where to order,
Yeah.
that would be helpful, along with the Expo website. And you can come and see Olivier at the Expo next month in Albany. Get your tickets at healthydogexpo.com, of course. And if he's not behind the booth, the other place you'll see him is behind the camera,
That's right.
because his other passion is photography. And he has taken some absolutely awesome shots, both of the expo and every dog sporting event that he's supported, which is just so awesome because you support the community,
We love that
dog
community.
agility, the fly ball, the dog sports. You give back, which is something that means a lot to the companies I work with. It means a lot to me about the companies I work with. So thank you for that.
It's up. We love this community. I mean, you have such wonderful people, and what I love is they're so smart too, and they really ask us so many great questions. And the beauty of it is when they see what it does, they're not shy to share the good news for other people.
Hmm.
We've had, as you mentioned, like Susan Garrett is a perfect example. Susan doesn't just promote anything; she will talk about something that she believes in, and I can tell you, I was with her in Florida just back in December, and she told me this is pretty much what she uses for orthopedic for her dogs.
Yeah.
All of her dogs are on the product, and we're not talking about just a few months ago, since 2016. So it's been a long
Oh
time.
gosh, since Feature had her leg things.
That's exactly right. It was phenomenal what it did for Feature.
Oh, and yeah, and
Encore,
and
yeah.
oh, yes, you're right, Encore. The thing I love about Susan when she endorses something, she doesn't just say, "I think this is great." She shows you with pictures and video over time how it changed the dog or
That's
how
right.
it achieved the results. So, there is no question in my mind what what transpired and how it helped. So, yeah. So
And and we do our very best too, and this is dear to my heart as well, is to make it affordable for
mhm,
people. And I will tell you, when you compare it to what's out there on the market, first, this is so different. But I just want your audience to remember that too. You're getting an oral health product. The most important part, the gums. You're getting an orthopedic product, not just the joints, but the muscles, tendons, and ligaments. You're
mhm,
getting also a product that helps with skin and coat, recovery and stamina. All of that, if you had to actually try to replace this, you would be paying a lot of money just to be able to get all of those different facets of promotion that you're getting in that one product of benefits. And even if you paid full retail, for example, of the 120 count, and like your audience right off the
yeah,
bat, you're getting 10% off. But if you just got one bottle, that's like for Sasha, this is a 4 month supply for my dog. Full
mhm.
retail is $65. I mean, you got, and for the smaller breeds, that's an 8 month supply with that 120
It is
count bottle.
not it is not an expensive product at
It's
all.
affordable. Yeah. And we've worked very, very hard in maintaining that. As we all know, costs have been rising,
Mhm.
but it's very dear to our heart. Our passion is I don't want to have one cat or dog with a painful mouth that nothing is being done. At least use one TDC.
Yeah, absolutely, absolutely. And, oh, Lily, little Lily. Yeah, I mean, put a price on that.
And I love that because we get so much of that. And to me, you have to understand, I only have one pet, well, family member, furry family member. It's Sasha. She's 14. So
Yeah,
when I hear stories of people experiencing what I'm experiencing with my own dog, with my own product, it makes me happy because at the end of the day, we want to see them as healthy and live the best life they can the longest. So
mhm,
it's all the things that we learn from your podcasts and some of your peers as well. It's getting all that knowledge. And one TDC just happens to be one of the facets that I do. But I feed raw and I different super healthy. I exercise, Sasha. I do all the things that I can. One TDC is just one of them. So
just one tool in your toolbox.
it's exactly right. Yeah, I use laser as well. I
Yeah,
have one of the multi-rating laser that I use for her, and then guess what? After the laser, I use the one TDC, just like
mhm,
we teach the veterinarians to do.
yeah. Multi-radiance, I don't think they are able I think they had a conflict this year. Last year, they gave us a laser to give away,
Wow,
which was phenomenal. They
great
are
people.
another awesome company that I will find a way to at least get them on here so people can learn, um, because
Absolutely.
they're awesome. Just
Yeah, I met with their chief scientist at one of the big veterinary conferences, and he was so excited about one TDC because of what he heard from Dr. Taraka. And the reality is, most people can't always afford a laser, and it's just a fact.
yeah,
I think they have some plans to help with that. But the reality is, you can still do the topical version of one
sure.
TDC at home, and then you go get your actual treatments of the laser. So it's like it's a beautiful marriage between the two products and solution.
Without a doubt, without a doubt. Tracy gives big thumbs up to lasers.
Mhm.
And I see our friend has left us. I guess he doesn't want to talk. Shucks.
Won't be the winner.
Yeah, yeah. Olivier, thank you, thank you, thank you so much for being on here and taking the time today. And I can't wait to see you next month.
I'm looking forward to it. I mean, you and your team do a beautiful job at this conference. You have incredible speakers, and I think you're also very selective of the people that you bring. So the quality, I know I'm one TDC, but it's not just about one TDC. The other vendors you bring on as well are very
Yeah.
wonderful people. So I look forward to it, and your customers are very loyal too. We love going
Well,
to.
they all want what my sponsors offer. So it's very easy to pick out who I want to come. And so far this year, bring product because the shopper passes have had a big upsell. So we have people who come to the expo just to shop, mostly locals, obviously. But yeah, it's going to be fun. So thank you again, guys. I will be back tomorrow at this time, which is Friday, March 8th, with Wendy from Dr. Harvey's.
Oh, great people, great
Good
lady.
people. Good people. They've been so supportive. So
Yeah,
thank you, and we'll see you tomorrow.
my pleasure. Thank you, Dr. Kojer.
Bye.